Hello, everyone, and welcome back to episode 67 of Your Birth Bestie podcast. Today, I am less than a week to my due date of July 8th, so positioning of baby and helping my body be ready for birth has, of course, been on my mind a lot lately. So I wanted to share some information with you about positioning and tips for how to promote optimal positioning during pregnancy for an easier labor and delivery. Hey there, I'm Beth Connors, a midwife and mom of two, but also your birth bestie. In this podcast, we'll dive deep into everything you need to feel confident, prepared, and in control, from baby bump to delivery room, from practical tips to personal stories. We'll cover it all so you know exactly what to expect every step of the way. Let's get into it. I first want to put a disclaimer out there that I don't think there is truly a best position that is universal for all babies and all pregnant moms. Just like everything else that we talk about, this is individualized. However, in this episode, when I talk about optimal positioning for baby, I am referring to the occiput anterior position, or OA, because this is the position that has been shown to have the best labor outcomes in terms of vaginal deliveries without medical intervention and complications. So typically by 34 to 36 weeks of pregnancy, we like to see babies settling into this optimal position, but it also can vary. The larger your baby gets, the harder it can be for them when they are running out of room to encourage them to turn into this position. But I've also heard of head down babies in labor turning breech, or vice versa. Pregnancy and birth is so unpredictable, but we can still prepare as best as possible and control what we can, not worrying though if ultimately our experience has to pivot a little bit. You can be prepared and confident in all situations, and I am optimistic that it is absolutely possible for you to have a baby in the best position and have a really awesome labor and delivery experience. So we can start, though, by understanding what baby's position means, specifically OA. And this means that your baby is head down with their back facing your belly and their chin tucked into their chest. So basically envisioning that as your baby is born, they are head down, and then if you are lying on your back, which hopefully you aren't in labor, right? The baby's face would be looking down. In this position, the smallest part of the baby's head leads the way through the birth canal, making it easier for the baby to navigate through your pelvis. But this isn't always the position that babies settle into, which then can make labor a little bit more challenging. So I wanted to talk through some of these positions. And first is occiput posterior, when baby is still head down, but their back is against your back. And this is often called sunny side up because if you are lying on your back, baby is delivered and is looking directly up at the ceiling instead of before, when we talked about OA, baby is in that opposite direction looking down at the floor. Babies in the OP position can lead to longer and more painful labors because the baby's head may not align as easily with the birth canal. This can also cause back labor. If you've heard of back labor before, a lot of times baby is in this OP position, which can be really intense, and pain is felt in the lower back during contractions, and overall just makes things possibly progress more slowly and can just be more difficult on mom. Breech position is when the baby is positioned with their butt or one or both feet pointing down towards the birth canal instead of the head. Breech positions can complicate vaginal delivery. However, the more that I am learning, the more providers are starting to become trained again in vaginal breech birth, and it has been an option for families more often now rather than scheduling a C-section automatically. More of an informed choice situation, which I love, and I hope education and resources continue to be available for women whose babies are breech, so we don't have to jump to that intervention of having major abdominal surgery if a vaginal delivery is possible as well. There's also transverse lie, where baby is lying horizontally across your belly, and this would not be a possible position to deliver vaginally unless baby shifts to a head down or to a breech position before your labor begins. A C-section would definitely be necessary in this case. And then the last lie I wanted to talk about is an oblique lie, where the baby is positioned at an angle with their head or their butt pointing towards one of mom's hips. And this can also complicate vaginal delivery. And just generally, the position of your baby can affect the length and comfort of your labor. When baby is in that OA position, it can make the birthing process more efficient, less painful, where the less ideal positions can lead to longer, more difficult labors and may require interventions such as turning the baby manually or opting for a cesarean delivery. Understanding your baby's position can help you take proactive steps in pregnancy or even during labor to encourage that optimal position and hopefully make it a little bit easier on you. So we can now talk about some practical tips and techniques that can help encourage your baby to move into that optimal position for labor and delivery. I will talk about daily activities, specific exercises, and some alternative therapies that you might find helpful. Of course, I am not your medical provider, so these are general recommendations that might be a good option for some moms, but also individualized care is so important, so please check with your provider if you are unsure if any of these apply to your situation. One underrated piece of baby's positioning is, in general, just staying active and incorporating certain exercises into your daily routine when you're pregnant early on if you can. It doesn't have to be this huge, complicated list of exercises to promote good positioning from the very beginning. It's really just a few things to try. And these include just two main things, which are pelvic tilts and walking. And on a side note, swimming is also a great exercise if you're up for that, where it takes the weight off your joints, allowing for full range of motion, and that buoyancy of the water as well can help baby move into a better position. I don't personally have access to a pool on a regular basis, so I haven't done that, but pelvic tilts are a simple and effective exercise too, and walking is something that I enjoy doing with my family, so have made that more of a priority during this pregnancy too. So for pelvic tilts, what you would do is get on your hands and knees, keeping your back straight. You would tilt your pelvis forward, pulling your belly button in towards your spine, holding that for a few seconds and then releasing. There really is no rules to how often to do this, but maybe 2 sets of 10, doing that in the morning and then at night to help encourage your baby settle into a good position. The guideline on walking isn't rigid either, but it does help to keep your pelvic floor loose and flexible and helps baby into a head down position. So maybe 20 or 30 minutes per day, whatever you can work out in your schedule would be great and seems doable for most people. If you're looking for something more specific in addition to those regular daily activities, there is a well-known method called the spinning babies approach that you might have heard about before. But spinning babies covers several exercises that help create space in the pelvis and encourage the baby to move into the optimal position. A few of the more popular exercises are the forward leaning inversion, side lying release, and lunges. There's also the breech tilt to help turn a breech baby if that's the situation that you're in. But the forward-leaning inversion is where you will kneel on the edge of the couch or a bed with your hands on the floor and your head lowered, holding this position for about 30 to 45 seconds, and then carefully returning to an upright position. If you are doing this during labor, holding the position through one contraction, coming back up to a kneeling position, and then once more for another contraction is what is recommended. This exercise helps to relax the lower uterine segment and all of your ligaments around your uterus, giving the baby some more room to move. It can be helpful if baby isn't in the best position, or maybe if labor is stalling for a little bit and you're trying to get things going again. The side lying release also helps make more room for baby and can be done every 4 to 6 hours during labor for moms with an asynclitic or posterior baby and are maybe having a long labor or back or pelvic pain, anxiety, or is just requesting to try something different in labor. It can also be done during pregnancy at any time as long as it is comfortable for mom. This one is more difficult to explain, but I will link all of these positions in the show notes as well with visuals, so hopefully that including that will be helpful. You're basically lying on your side as close to the edge as possible with your belly kind of hanging off the bed, and your top leg will be dropping down in front of you with the support of your doula or a birth support team member. You would lie on one side for 3 contractions and then switch to the other side for 3 contractions. And this exercise temporarily lengthens the pelvic floor muscles by releasing tension and evening out the pelvis to help baby navigate into a better position. And then if your baby is breech, so butt first or feet first, you can do the breech tilt. This is where you lie on your back with your knees bent and your feet flat on the floor. You would place a pillow under your hips to elevate them about 9 to 12 inches off the ground. This position can help encourage a breech baby to flip to a head down position. And you would hold it for 10 or 15 minutes and repeat 2 to 3 times per day. There are also other exercises specifically for breech if that is the situation, again, that you are navigating. And I will dedicate an entire episode to turning a breech baby in another episode, so I won't include that information here. I also want to touch on posture and body alignment because it can also play a huge role in baby's positioning. So being aware of this as your pregnancy progresses hopefully helps too. As far as sitting positions, it is best to sit forward with your knees lower than your hips and your back straight. Maybe use a cushion to support your lower back if necessary, and avoid reclining if possible because that can direct baby's head in the opposite direction of where we want it to be. Also, not crossing your legs if possible because that can create an imbalance or tightness on one side, limiting baby's ability to navigate the pelvis and descend into an optimal position. And this one is hard for me typically, but as my belly has gotten bigger, I honestly don't feel the need to constantly cross my legs like I normally do. So I guess that's probably a good thing. A great tool to use at any point in your pregnancy that I am loving right now, it's like the only thing that's comfortable to sit on, is getting a birth ball, which is also the same thing as an exercise ball, having one at home or at work, wherever you're sitting the most, or even at both locations. They are so helpful to improve your posture, keep your pelvis in an optimal position, and also allows you to kind of gently rock your body, do some hip circles, and encourage your baby to move within your pelvis. Some moms also find relief regarding pregnancy discomforts and also improved baby's positioning through chiropractic care and prenatal massage. Finding providers that specialize in assessing and treating pregnant women, though, is probably the most important piece. Chiropractors who specialize in prenatal care can perform adjustments to help align your pelvis and your spine. And they can also use a technique called the Webster technique, specifically for these adjustments that aims to balance the pelvis and reduce tension, which can help the baby or encourage the baby to move in an optimal position. I did this early in my 3rd trimester for a few sessions, and the provider that I saw was really great, really knowledgeable, and the adjustments were very gentle and intentional. I also saw a prenatal massage therapist that I personally was able to find more relief with due to what I was experiencing with pubic symphysis pain and sciatic pain, and was able to find relief with relaxing those tight muscles and ligaments with that manual therapy, hopefully also creating more space for my baby to move. Making sure also to see a massage therapist who is trained in prenatal massage is an important part of this as well. Both are great options to do either together or maybe trying both and seeing which one you prefer. Lastly, there are alternative therapies like acupuncture and moxibustion. These can be beneficial in helping baby move into the best position possible. I have heard several stories of these working to help turn breech babies into a head down position, which is pretty cool. Acupuncture involves the insertion of thin needles into specific points on the body, and I am no expert, so if this is something that you're interested in, definitely more to learn about with acupuncture. I've had it done, not in pregnancy. It's not painful. It's actually really relaxing, but not something I've ever done in pregnancy. So if you've had this experience, I would love to learn more about your experience with acupuncture, especially if you were able to turn a breech baby to the head down position. And then moxibustion is a traditional Chinese medicine technique that involves burning an herb called moxa near specific acupuncture points. It is often used amongst acupuncture to encourage a breech baby to turn, like I mentioned, and is something that I've heard has pretty promising results. But I don't also know personally that much about it. So I am actually scheduled to take a training in moxibustion at the end of this month. So I will definitely keep you posted about what I learn, and maybe we'll do a whole separate podcast episode specifically on moxibustion, which I am excited about. So overall, I hope it's reassuring to know that there are a lot of things that you can do to encourage your baby into the best position before your labor starts. Also, things you can do in labor to help your baby move throughout your pelvis. This is not an exhaustive list at all, just a few commonly used ideas to help, things that I found helpful for myself or for clients. So for more information, definitely using Spinning Babies as a resource to look at their website and see what recommendations there might be for wherever you are in your pregnancy journey or whatever situation that you are navigating. I also follow the Body Ready method on Instagram, and they have an amazing program for professionals and also classes for parents to prepare the body for birth, and a lot of which is exercises to create more room in the pelvis and help align the body for labor. So all of these resources I will link in the show notes below, and I hope they're helpful for you as you prepare for your labor and birth. Thank you so much for tuning in to Your Birth Bestie podcast. I hope you found today's episode helpful. If you did, please subscribe, leave a review, and follow me on Instagram at BethConnors_CNM. I will be back here next week with another episode all about prenatal breastfeeding education with my favorite board-certified lactation consultant and postpartum nurse.